Welcome to the Caregiver Relief Podcast. I'm your host, Diane Carbo, RN. Today's conversation is one I wish every family could hear before they make a care decision, not after. I worked in assisted living as a director of nursing, and I was also licensed to be an assisted living facility administrator. So when I say this next sentence, please understand there is a reason for why I'm saying this. Assisted living is the most misunderstood and often the most dangerous segment of our senior care system. Yes, I said it. It operates, and the reason why is because it operates on a social model, not a medical model, and there's a wide gap between what the families believe they're paying for and what they're actually provided. And that's why I'm so grateful today to be joined by Emma Soy, RN, founder of Gentle Shepherd Care, a leader who is changing the way families think about aging, chronic illness, and what's truly possible at home. Emma has created a free resource called How Dad Stayed Home Thriving Instead of Declining in Assisted Living, because families are making $320,000 decisions with incomplete information, and they deserve better. So let's dive in. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Emma, thank you so much for joining us. I want people to understand that we are in a public health crisis right now, and I'm trying to provide them solutions to the crisis. So thank you so much for joining me today.
Thank you for having me. It's always a joy to be able to, as a fellow nurse, to be able to be talking about these topics and topics that are dear to our hearts.
Yes,
And
yes.
I love talking to you because you know the industry, you know the ins and outs. And sometimes when you talk to other people who are not in the industry, they're like, really? But, so I love the conversation. So let's do
Yeah,
it.
I love Gentle Shepherd Care, the way you approach things. So before we dive into the systems and models of care, tell us personally what led you to create Gentle Shepherd Care.
I've been a nurse forever. And you've been there before me, but I'm the old nurse. I remember when I used to be the youngest nurse on the floor, but now
Me
I'm
too.
the oldest nurse. So I've been a nurse for a long time. I've done different things in nursing, and this is why I love nursing, because it gives us the variety, the different things to be able to have the kind of different experience. So one of them is managing chronic diseases. So I used to work as a care manager. I had 37 doctors that I would manage their patients with living with chronic diseases. And that was when I lived in Illinois. So when I moved here to Charlotte, I continued to do that independently as a care manager. And in 2019, I started a home care company. I added home care to my service to provide home care to people who are aging in their own homes. What I discovered was a lot of people who were doing that, a lot of other home care companies or what families were asking me. And I was just watching people decline in homes. I'm like, okay, this is not what nursing is. As a nurse, I put my nursing hats on and started to see how can we do things differently. And so since then, I've come up with develop a pathway that we can adapt to care, to make a different model where people do not just decline, but they can thrive. And not just in the home, but wherever. As an older person, they have the right to be able to thrive. Not just saying that, but actually applying principles that would actually show that people are thriving. And so,
You are fundamentally different from traditional home care agencies. So I'd
mhm,
like you to share when you talk about the holistic care, and I love that because we are such a segmented society. You go to when I became a nurse as a young nurse, orthopedics, an orthopedic surgeon would do hips, knees, soul, backs, whatever. If it was a bone, they fixed it. Now we're very specialized,
yeah,
and it's made it harder for us to get good care
yeah.
because it is so
Well,
segmented.
the traditional home care, traditional non-medical home care, this is what we call it. Because it's non-medical, anybody can open a non-medical home care.
Yeah.
So it could be a business person. So that's the first thing that I noticed. The people who are running home care companies, they were just because my mom had Alzheimer's. They didn't have that clinical background.
Yeah.
People think it's just so easy to just run home care companies because then the traditional is okay. Send a caregiver to help someone with activity of daily living. Get me out of bed, wash, clean the house, do errands, meal preparation. And so that's the basic of non-medical.
Uh-huh.
And that is why the states allow anybody really to be able to run this kind of home care company. But when I came on, even though my home care license says it's a non-medical, because as a clinician, I was looking at the basic things that we need to add. That people need, they need more than help me with the activity of daily living. Because why does this person needing help with activity of the daily living? It's because they're declining. So
Yeah.
either declining mentally or physically. So what are we doing with that? And so that's where I came up with the pathway where I focus on the basic things that we don't focus on, such as nutrition. So in each of these topics, each of these pathways could be like a whole show on itself. So I
Yes.
think I'm sure we can, but nutrition for the older adults. Older adults cannot eat the same way that a young person eats. I can't eat the way today I eat in my 50s the same way that I used to eat in my 20s. So the same thing for the older adult. They cannot continue to eat the same way when they're 80 or 70 just because things are happening in their bodies, things have to be adjusted. So nutrition, having someone focus on that and looking at what they need, because of that, again, each of these topics could be a whole show. But
Yeah.
nutrition, hydration, sleep mobility, medication management. A lot of these older adults are on tons of meds and they
Yeah.
sometimes over medicated and they're not being managed. Pain management, or the chronic disease that they're facing. It's not being managed. We give pills for them, but we're not helping manage them. The person living with hypertension, diabetes, or heart disease, how beside giving a pill, what else are we doing to help them manage that? Because those are chronic disease we all know could be we call reversible. How are we
Yeah.
helping them that with reversible? And then
Yeah.
then we have sleep, and then we have emotional. Like how do you help this person? How do you help an older adult get up every day, wanting to get up every day because they have a purpose for living? If
Yeah.
you got to be able to take care of all these things so they can do that. So that's my pathway that I have added to my home care to make it more holistic instead of non-medical traditional home care.
I love this, and I want you to know, and my listeners to know out there, that while Emma is a non-medical home care agency, she provides RN oversight, which is so critical. And Emma, I don't know if you're aware of this or not, but they have cut the skilled nursing care when your skilled care needs the OTPT speech and RN coverage in traditional
Home health.
medical home
Mhm.
care. They are not paying for a nurse to go in oversee the cases. And what I am seeing is frightening. I am
Mhm.
seeing people come home with discharges with wound care that wounds that weren't even documented in the rehab center. Because I don't know if you've heard about patient rights. I know you have, but some states say you have a right to fall, you have a right to develop pressure sores, you have a right to
Eat, yeah.
yes, and not be turned and develop pneumonia. It's all on you, which goes against everything I've learned in my 50 plus years of nursing. So my head explodes. And when I see a skilled care nurse or therapist come in to open a case when a nurse needs it, I am very afraid because the education's not getting there. The observation of things like you've got new seizure meds. How are you responding? Or are you having a UTI and do we need to treat it? That's all being overlooked now by skilled nursing. And I've heard this. It's not just one or two cases,
Mhm.
it's a problem. So, your oversight is so critical for seniors, especially with chronic or progressive conditions. How does that change disease specific care for
So
outcomes? Yeah.
so then the thing is you still have that person providing the medical.
Yeah.
What make the difference is having the nurse care managing the care management piece
100%.
the care
Yes.
management piece of these specific things. It's not just having that like the caregiver go in and this, yeah, the caregivers still go in and do their caregiving things, but then when you have a nurse, a care manager, that's the combination that makes home care different, is adding that care management to caregiving to be
Yes.
able to manage these things to help people thrive. And that's the missing part. That's the missing part. Yeah.
It really is. And we are moving to Medicare has moved to a cost sharing platform, and patients now are being discharged home very early. In fact, those with Medicare Advantage plans are actually being charged $200 to $400 a day copay.
Where?
That,
And
oh,
skilled nursing?
well, and when they go to skilled nursing or rehab.
Okay.
So, they say we have 90 days, but because facilities are getting a higher level of reimbursement for not providing therapy, they're
Mhm.
sending them home. And this frightens me. So we are moving, and people don't realize it, but we are being pushed into everything's going to be concierge, a la carte services for our medical care. And the wealthy will be able to afford it. The middle class, the disappearing middle class, will take out reverse mortgages or whatever to get that care. So I'm really excited about promoting your approach to care because case management is absolutely necessary. Now, I want to talk about assisted living. Let's have a reality check here. Families often believe assisted living provides medical care. Why is this a dangerous misconception?
So the thing is with families, okay, so let's say someone has a loved one, like a mom, dad,
Yeah.
and then the person start to decline. The first thing the family think is they can't stay home. They
Yeah.
can't can they ask me the question, they can't stay home anymore by themselves, can they? Maybe there was a fall recently, maybe they're forgetting to turn off the stove, something scary. All of a
Yeah.
sudden, that person is asking, what's next? If my mom can't stay home, where do I send her? And then so the next thing they figure out, since everyone else is sending everybody to assisted living, they
Yeah.
start searching for assisted living because that's what we do when
Yes.
when we concerned, when we're terrified, and we don't know what else to do. But most people don't. The reason is that's because people don't plan. They don't. Most people don't plan this. They don't have an aging
Exactly.
care plan to be
Yeah.
able to educate, so like someone like me, to educate them in
Yeah.
advance, making that create that plan in advance when that time comes to say, okay, where does my mom go? Because there are different level of care for older adults. You don't
Yeah.
just jump to the highest level of care right away.
Yeah.
And so, not because assisted living is wrong, it's sometimes it's is it the right time is it the right place for that person at the right time?
I will tell my listeners that assisted living is based on a social model, not a medical model. And that means that the patient themselves must be able to direct their level of care. So they need to be able to express what their needs are. And when you get to a point when they're in dementia and stuff, dementia care, they're not able to do that anymore. And I have come across, this is where I've learned about, I know we have patients' rights, for
Mhm.
goodness sakes, I understand that. But when a facility won't let you bring in an alarm bed because bed alarms or chair alarms to alert the staff when the patient is up because they fall. I have an issue with that. I have an issue when they won't consider a low bed to be brought in and when a family's asking. And see, if they had a care manager, that you contact the facility and you make them aware that this is the plan we are putting in place because assisted living is supposed to be your home environment. So you
Yeah.
bring in your own furniture, you bring in
Yeah.
your own stuff,
Yeah.
and you should be able to. But facilities are, and the other issue I have with assisted living right now, especially in the memory cares, is the staffing is not in conjunction with the level of
Of
care
care.
required.
Yeah.
Yes. And we're seeing like 2 aides for 12 patients, and in a dementia care unit especially, that's not enough. That is
Mhm.
nowhere near enough,
Mhm.
and things are missed. So I really appreciate that you offer this service of care management because people don't know what they don't know, and that's what you are there to help them to make those decisions.
So even in the assisted living, if you are ideally, if you're bringing someone to the assisted living, you decide to do that, I do recommend that you also bring someone like me into the assisted
Yep.
living with that person because
Yep.
the same thing, the same kind of holistic care that I'm providing in the home, if that placing the person in the assisted living is the one thing that you need to do because sometimes that's what needs to be done.
Yeah.
When you bring that care manager, that care manager then become that person who apply those principles for you because the model, like you said,
Yeah.
is not a model of it's not a medical model. It's not,
No.
it's non-skilled. It's
Yes.
non-skilled care. It's the same thing that we provide
Yeah.
at home, but they provide it in a facility. It's non-skilled care. So a lot of time people think the minute they hear home care, they say, "Oh, it's expensive." Okay, so
Yeah.
the not only they think it's expensive, but they also think if I'm gonna spend $6,000 for home care, I can bring my mom to an assisted living because they get 24-hour care. People don't get 24-hour care when they're in an assisted living. That person is in their apartment the same way that they would be in an apartment. Yes, you have people
Absolutely.
available if they need something, but they're not getting 24-hour care. I
No,
mean,
they're not.
they don't have someone sitting with them.
Exactly, and I wanna talk about the à la carte services for
Yeah,
assisted living.
yeah,
I'm sure you're more aware of it as I am, but people think that, "Oh, they're gonna manage mom's meds. They're
mhm,
going to alert me once mom has an incident of some
yeah.
sort," and that doesn't happen at all unless you're willing to pay for it. They'll nickel and dime you for everything,
And
from
again, I'm not talking get about assisted living because it might be right for someone, but
absolutely,
my goal
and
is I want people to understand that there is a third option. The
yes,
third
yes,
option, because the average cost of an assisted living in the United States right now is anywhere between 4,500 to 6,500. But people don't understand that's a
yes,
base cost.
yes,
For memory care, it runs anywhere between seven to $9,000. But they don't understand that is base. It doesn't cover a lot of things. Before they know it, as they keep adding different things, med management, or they add toileting, they get different things
yes,
as the care level of care increases,
yes,
the cost also increases. But
yes,
here's what people don't understand. when someone moves into a facility, they often lose more than money. Like it's not just money. Okay. First of
Yes.
all, they're not in their own homes.
Yes.
So they lose that rhythm of their own
Yes.
home. Number two, they lose their community. Number three, they lose the control over their sleep. When I go to sleep, when I eat, when I this, when I bathe, all of that is decided for you. What day of the week do you take a shower? What time of the day that you go to sleep. Yeah. So that is decided for that person. That person just lost that control over these simple things
Yes.
as they age. Their sense of identity, independence, they lose that slowly. And sometimes even their will to even keep fighting or living. So that is not just how I feel. This is scientific. This is proven that this is what happened to older people when they move into an assisted living.
Yes. And I want my families to know and understand that if you understand that this is you're paying for uh, somebody to stay in an apartment and you're still overseeing their care, you as the family, then you have the right concept because that means visiting, monitoring doctor's appointments and
Mhm,
scheduling them. That means
mhm.
managing the meds. It's everything that you could do at home.
Yeah.
And
And then it's a fraction by adding care management, by adding a nurse oversight. That's what it is.
yes,
Oversight. And even if you don't have caregiving, even if you're the full-time caregiver, having a nurse oversight to be able to show you things, to be able to help you, because you're not coming from a clinical perspective. Even as a full-time caregiver, you are going to provide care based on like physical, but there are other things from a scientific perspective as a clinician that you don't have unless you
yeah,
are one of them. So
yeah.
it is still important to be able to bring that clinical oversight to be able to help you manage that person at home well. So my whole goal is, how do we help these people to thrive?
Yes, yes, and do it in their own homes, and I
Do it in
think
their own
that
homes.
absolutely it's the wave of the future. In fact, I know they're moving hospital into the home
Mhm,
so that high acuity level patients will remain in their homes. I'm assuming it's for OPDers, those with breathing disorders. I'm trying to figure out maybe MS, what kind of clients they would
mhm.
send home in the hospital for the family caregiver to take care of. But I do know more and more responsibility is put on the family caregiver to provide.
Well, the other problem is the family caregiver. We forget that most of these families, they work. This is,
Yes,
I call myself the panini woman because I'm managing a sandwich generation. The sandwich
yes,
generation, we all talk
yep,
about it's the new term now, is that
yeah,
person who's in between that person, that woman, because primarily, the most likely, the primary caregiver, the family caregiver is a woman. And yeah, we do find men doing it too, but
yeah,
majority is a woman who's working full time, running a home, running her own life, and then also caring for her aging loved one. I don't say just mom and dad, because you can find people taking care of their aging family member or
yes,
someone that they love, that they want to be they caring for them. So that person is being squeezed in the middle. And that's the same person doing the appointments. They're the same person doing homework and with children. They're the same person managing the memory care facility during their lunch break. It's the same person managing discharge planning when that person is in it's the same person. And so, yeah,
absolutely.
yeah,
Yeah. I do want my listeners to understand that assisted living communities rely on outside home care agencies to meet the medical needs of
yeah,
their residents in the assisted living.
yeah,
And that means so if you have medical needs of any kind, whether it's wound care or blood pressure monitoring, that and this is why I think a nurse care manager is really important, Emma, because you can be proactive at making sure these are addressed early on instead of
yeah.
in a crisis fashion.
Yeah, yeah. Just imagine a care manager coming in with this pathway and a skill and assisted living,
Yeah.
helping to apply some of it. Some of it are not as because they have set meals, for example, everybody get the same food kind of thing. So it might be a little bit difficult when when you try to manage, when you try to do the nutrition, but when you have someone advocating for you, so that's a little different. But definitely the hydration part, the
Yeah.
mobility, and all that stuff to be able to oversee that it's being done. People can talk about, yeah, we do this, but do they really get done?
Yeah. Here's a perfect example. I had a client call me all upset. Mom's in a very upscale assisted living. I helped bring her down during COVID from New York to North Carolina. And the son calls me because he found assisted living for her, and she's in a memory care unit. Sweet little old lady. And she became a demon. And she was, for 2 weeks, she was acting out. And he calls me up and says they're throwing her out because of her behaviors. And I
Mhm.
said to him, "Really, Frank?" I said, "Did they check her for a UTI, urinary tract infection?" He said, "I don't know." I said, "That's the first thing you need to do. Anybody in healthcare would know to do that as soon as you
Mhm.
see a change in mental status." And I said, "If it's not that, then the next plan is you have them admit her, take her to the ER and admit her to a behavioral health. Maybe she needs medication management." And that's my caregiving approach, okay? Don't you know it? He calls me 2 hours later. His mom was septic from a urinary
Yeah.
infection.
Yeah. Yeah. That's often. Yeah.
Yes, and that's because nobody's monitoring that patient.
Yeah.
And the very same people that are working at Walgreens or CVS or even at McDonald's are passing pills and overseeing
Yeah.
interacting with your family member, but they don't have medical knowledge. That's why
Yeah.
I really feel care management is so
Yeah. Important.
important,
Yeah.
especially now with our broken healthcare system.
Yeah. See, the other thing is when the family visit an assisted living, they tell them several things. Like they have 24-hour supervision, number one, which is okay, you have 24 hours, you got people in the building 24 hours. That's one.
Yes,
The other
that's
thing
right.
is they don't understand that the majority of the care is being cared by these people that you just listed. Okay.
Yes.
The majority of the care is being done by non like non-medical, like
Yes.
non-clinicians. Okay,
Yes.
so that's most of the care. So the other thing is that they tell them is we have a nurse. You have a nurse for how many people in your building? The nurse doesn't work 24 hours.
Yes.
She doesn't see everybody. She's available if something happened that needs her attention, but she's not managing anybody's care.
No. Absolutely,
So people want
absolutely.
to understand that when they say the assisted living has a nurse, because the state requires that they have a nurse, just like a home care agency, they require that you have a nurse, but that doesn't
Yeah.
mean the nurse is going to see everybody, right? It's
Yes.
managing the care.
Yes. I know from my own personal experience as a director of nursing of a very upscale assisted living outside of Philadelphia that what I saw frightened me. And it's just that people just don't know what they don't know. And things are often missed. And when they say they have 24-hour care, you don't know how many times somebody falls in their room and they aren't seen till the next morning.
Yeah. Hmm.
It
So
happens
yeah,
because they're not going in and doing rounds and checking on them. So that's why it's important that people understand it has to be done by you have to be the family that monitors everything if you're going to put somebody in assisted living
see,
because otherwise it's just you could be having them in their independent living in a senior high rise and it would be the same thing.
yeah, yeah, you're right. So the thing is that I would like the public to know is this: all of this falls in non-planning. People don't
Yes.
plan.
Yes.
Elder
Yes.
care is not planned. It happened. People let elder care happen. And this is the reason.
Yes.
Because if it was planned ahead, you
Yes.
wouldn't be in the wrong place at the wrong time.
Yes.
You would be at the right level of care at the right time because you have guidance. It does it the the cost of planning is peanuts
Yes. Yes. Yes.
compared to the cost of the care that you're going to provide later without planning.
And I want you to know those solo seniors out there that have never had children, planning is even more important for you
Mhm.
because you're going to have an attorney or a fiduciary looking over your life. And I can tell you from my personal experiences, even in a very posh, upscale assisted living, that things get missed.
I
And
wish I wish I had a slew of solo agers
yes,
as in my caseload because
yes,
solo agent, and I don't think solo agents even know that this is who they need. They need a care manager in their life
exactly,
because the solo
exactly.
I am the one who put all this stuff together for you so you can have it. That's what I do for my solo agents. So they can have the peace of mind knowing that when something happened, I have a phone number, I have a person. I know that I know where I'm going. I know how much this is going to cost. And this is very important. As much as it's important for people who have children, so much more for people who do not have any who's aging by themselves.
Exactly. Now, you wrote a report, a free report for seniors to see on how dad stayed home thriving instead of declining in assisted living. What
Mhm.
inspired you to create that report?
So I created the report to give people a perspective on the to compare,
Yeah.
to see what it looks like when compare the two. Someone aging in home with care management and someone going to an assisted living, and how the things that we do that help them to thrive and how they thrive better, to show the proof how people are thriving better with that model of care
Yeah.
instead of with aging without that model,
Yes.
whether it is in the home or outside the home. If somebody's aging in the home with basic home care, you need that kind of model of care. If you're aging in an assisted living without that, you need that model of care. You need that oversight.
100%. And that's why I'm so excited about sharing your information because we are in a crisis, public health crisis right now. And with the silver tsunami coming, people need help. And as we move to the cost sharing plan, people are going to need reverse mortgages or they're going to sell their assets to be able to pay for care that will be needed on many levels. And that's why I think that you're encouraging aging plan in place early is so important.
And then to let them know they don't have to do this alone. They don't have to do
Yes,
this alone because
yes,
every time I see someone try to do this alone, they made so many mistakes. It's costly.
oh,
Last year,
absolutely.
I met a couple last year who called me. By the time they usually call me, it's too late. There's nothing I could do. It's
Yes,
on the
yes,
track. The couple called me because he was in the crossroad between this. So when his wife has beginning Alzheimer's and he himself is declining. So the two of them, plus
yes,
he has a daughter, and they were living in a home, and they thought, you know what? This is what we're gonna do. We're going to downsize. What we're gonna do is to downsize. We're gonna sell our home. So they sold the house and then they downsized. Now, this is a home that they were not paying. They were not paying a mortgage. So
yes.
they took this money and go rent an apartment, two-bedroom apartment. Okay. And
Uh-huh.
now, almost a year later, they just realized they don't have any money.
Yes,
Now that she needs care, they don't have any money for care. People are not thinking that you need money for care.
yes,
You need money for care more than anything else as you age. So making that mistake, the number one mistake he made was not to sell that house.
yes,
He
yes,
needed a place to stay.
yes,
Now, he's the kind of person who probably could use a reverse mortgage. So
yes,
that reverse mortgage, he could use it for care. Exactly. So at least you still have a place to stay, but now you can have the money that can provide the care for that for the two of you who needs it, because the two of you is too expensive to go to an assisted living. One
Yes.
person is $6,000. The two of you is more expensive. You don't have that money.
Yes. Yes. And people don't understand that.
People don't understand that. That's why you need
Yeah.
someone with knowledge of the system who can
Yeah.
direct you and create that plan with you.
100%. So, Emma, if families just take away one thing from that report before making a care decision, what do you hope it is?
Plan ahead.
Yes. Yes.
If you plan ahead is going to save you heartache, it's going to save you money, and it can help people to thrive. And that is why I'm so passionate about this topic. Plan ahead.
Yes.
Don't wait until mom fall. Don't wait until somebody goes to the hospital. Don't wait when you're calling people at 8 o'clock at night looking
Yes.
for home care. Don't wait to look for a provider when you need it. Don't wait for that.
Yes.
Every older adults need to have a care manager in their lives.
I agree 100%. And Emma, how do people reach you?
They can reach me. They can call our office at 704-209-5040. They can email me directly at emmasoy@gentleshepherdcare.com.
Great. And to my
They
listeners
can
out
just
there,
check, or they can check our website,
yeah, perfect.
gentleshepherdcare.com. Yes.
Yes, yes. And all that will be on our website that I
Yeah.
create for you.
Yes.
To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self care every day because you are worth it.